Well, Dr. Gupta is still with us. Dr. Gupta, one question that I have to ask you, especially when it comes to neonatal care, is that fire can become uncontrollable, right? Because when you're talking about neonatal care or NICU or even a normal ICU, there is a chance that the environment can suddenly become oxygen rich, which could, help in the fire to spread because you have oxygen pipes that are there that are being supplied to the patients. It could suddenly become very highly oxygen rich environment that could result in something of the fire, spreading immediately and without warning as such, because suddenly the room's oxygen levels could rise immediately. Do we have some kind of a safety measure for that also? And that seems to be one of the critical aspects also, isn't it? Because the room shouldn't become oxygen rich if there's a fire.
I think, Bhargav, this is a more important question. ICU specific fire safety checklist is there. All equipments and monitors like ICU monitors, ventilators, they should be functional and they should be inspected for electrical safety every week, daily and monthly from local internal engineer or fire safety officer. Second, patient evacuation from ICU or NICU is very critical, and priority-based evacuation plan for critical patients should be established in any hospital. Evacuation tools like evacuation chairs are separate, stretchers are separate. For neonate, I think there are the stretchers, not there are stretchers, there are warmers, patient warmers. We can shift with the patient warmers also. There should be controlled access in NICU, like NICU doors and ICU doors should be fire rated. Most of the doors, they are not fire rated, and because they are not fire rated, the fire can go at any level at that moment of time. Emergency override for the doors locks should be operational. Oxygen supply we were talking about, that is the most critical area, that is most important for saving lives also, and that can exaggerate fire also. Centralized oxygen system should have emergency shut-off valve so that it can be shut off immediately. Proper ventilation it should be ensured to avoid oxygen built-up. Otherwise, it will just enhance the fire inside the ICU. So that is the most important point in terms of oxygen supply in any NICU or any ICU. There should be surge protectors also, like electrical surge protectors are used for critical medical devices. If there is a short circuit in any devices, that can be immediately stopped if we have surge protectors. Most important thing is the knowledge of the staff working ICU or NICU or paramedical staff. They should be trained. They should be multiple time trained to manage such fire emergencies. And there should be separate mock drills also to audit their training and their skill set. And there should be root cause analysis also. If there is any leakage or any mishappening or any non-compliances, root cause analysis, then there should be corrective and preventive action so that it should not happen. Like if something is happened already, it cannot be prevented. We can do only corrective action. But to prevent something, we should train our staff. We should impart knowledge and skill set to them. We should do regular audit in terms of their written questionnaires or in terms of mock drills so that we can see where is the leak, where is the NC, where is the non-compliance, and it should be immediately corrected, immediately prevented also, so that it should not happen in the future. I think if we follow all these protocols, any ICU, any neonatal ICU, any cardiac ICU can prevent such incident or we can minimize such incident in future also. That's my point.
Well, Dr. Gupta, thank you for in fact giving us an insight into the aspects of security and safety that we need to in fact keep in touch when we look at the situation, and hope we are able to wake up from this tragedy, several such tragedies happening, hoping we are able to wake up from such tragedies and to ensure that safety aspects and safety audits at hospitals are also carried out. Thank you, Gupta, for joining us early in the morning itself and giving us an insight into this.